after stroke, I was just sitting down and I just felt. The day I just felt, and my mommy had to come. She took me up. I even urinated myself. I was bedridden for 6 weeks. Changed my organs dramatically because for one, I wanted to become a nurse.
Yes.
Because I can't do that anymore.
Okay. Sorry about
Relationship wise, I never had a relationship because everyone used to be done now.
Okay.
And until about 6 years ago, I have a son. I operate a beauty business. I make homemade soaps, hair oils, hair oils.
Okay.
I would say anybody with a stroke, don't let people make you feel like you're not valuable to society.
Yeah.
I don't make nobody put you down because a lot of people had put me down and to a point that I had low self-esteem, but I gained back my self-esteem. So don't make nobody put you down.
In Office with Dr. Jevon Samuels.
Welcome to another episode of In Office. I am Dr. Jevon Samuels. In Office is a program which we talk about life, sickness and death, and it's a very good program to get informative medical content, right? And today my guest here will be discussing stroke in the young, and her name is Miss Richtrisha Miller. Thanks for coming. Alright, good. Alright, so before we get into the interview, please remember to share, like, subscribe and leave a comment on this video that you can benefit others who are having similar medical condition and would need moral support or advice with the condition. Now, stroke is a condition in which a blood vessel in the brain is either blocked or it bursts and result in damage to brain tissues. So normally if a blood vessel is blocked in the brain, then the brain cells would be deprived of oxygen and hence will die within a few hours, will actually die, right? And causes of a stroke normally either we have clots block up in the vessels or we can have plaques build up in the vessels. Sometimes the blood vessels may burst, etc. Also we have other conditions such as vasculitis which can also cause a stroke, right? But we're not going to get into all those conditions today. Now, there are three major types of strokes. We have ischemic stroke, that's a stroke when there's a blockage in the blood vessel. We have hemorrhagic stroke, that's when there's a bleeding within the brain. And finally, we have what some persons classify a TIA, transient ischemic attack. It's actually a mild or a warning type stroke, which the vessel is blocked, but actually is clear on its own. So in terms of the deficit normally don't last for a long time. A stroke may be life-changing illness for anyone, right? Because normally is a condition in which can affect the movement of one side of your body. It can affect your speech and it can also affect swallowing, etc. Right? It also affect consciousness in some patients. Now, normally for the signs and symptoms, we use the acronym FAST, F-A-S-T, for the general public to be aware of the signs and symptoms of a stroke. So the F in FAST stands for face. So we normally have a facial asymmetry, like we have a drooling of the face or twisting of the face. That's one of the first signs of a stroke. And one side of the face actually is deformed, all right, suddenly. And the A normally stands for arm, and it's normally a unilateral, meaning just either the right side or the left side of the body that gets weak. And the arm, most often than that, is the right arm or the left arm will suddenly get weak and unable to move it, but sometimes it can also involve the lower limb, can also involve in the weakness. But whichever the case may be, with stroke in terms of weakness is normally the entire one side of the body becomes weak. But sometimes the hands may be weaker than the leg, and the hand may be weaker than the leg, or the leg may be weaker than the hand, right? Now you also have the S in FAST stand for speech. So normally the patient will have a slurred speech or they have difficulty understanding speech. Alright, and then time, even though it's not a symptom, we add time to this signs and symptoms for the general public, because I want the general public to be aware that time is very essential when it comes down to stroke, because the treatment of an acute stroke can determine how well the person recover and the amount of damage is done. Because initially, for example, if the blood vessel is blocked, it will take within a 6-hour period. There are certain procedures or medication that can be given to either break down the clot or surgical procedures to remove the clot, which can actually better the outcome for the patient. Now, in terms of risk factors, normally there are certain illness that put you at increased risk of getting a stroke, such as hypertension, one of the main risk factors for a stroke. It's called a silent killer, and normally hypertension results in damage to the blood vessels, and a stroke is actually a common complication of uncontrolled high blood pressure. Also have the other lifestyle disease such as diabetes, also a risk factor for getting a stroke. You have cholesterol problem, high cholesterol problem. You have persons who smoke are at increased risk. Persons who are obese are also at increased risk. And you also have some additional conditions that can put you at risk for a stroke, such as vasculitis, or sometimes blood vessel may be abnormal in the brain. But we're not going to get into all of them in this case. Now, in terms of how we diagnose stroke at the hospital, normally we do a CT scan is the ideal imaging of choice to diagnose a stroke. Normally we have the clinical signs and symptoms. However, we definitely need to do a CT brain in order to pinpoint where the stroke is and the type of stroke, because before we can implement treatment. Now, in addition to the CT brain, we normally would do some other blood works just to check the cholesterol and to the blood sugar, etc. And just to check the additional modifiable risk factors so we can prevent a recurrent stroke in the future. Now, in terms of treatment, as I was said before, we have within the first 6 hours, the person reach to the hospital that have the facility and the specialist, then they can get a CT brain within the first 6 hours and implement medication which can break down the clot, or they can do some endoscopic procedure to remove the clot from the brain if there are some larger clots. However, if we miss this window, then normally after we get the scan, we need to treat the patient with antiplatelets such as aspirin, and also cholesterol medication will normally give the patient as well. And also, some patients we may need to control the blood pressure, the diabetes, or the additional, or some of the other treatable risk factors that they might have. Now, for example, if someone already have a stroke, we normally the rehabilitation process is normally a part of the ongoing management of this patient. So some patients who have a severe weakness may need physiotherapy to help them rebuild the strength in the limbs, as well as to help with the mobility. Alright? And some persons may need a device to assist with walking. These are also part of the rehabilitation. You may also have the patient been seen by a speech therapist for those who probably have difficulty speaking or understanding speech, and speech therapy will normally help those patients. And in general, supportive care from the family is normally important for persons with a stroke in order for them to do well, right? Because normally if you don't have family support and you have a severe deficit, then you can end up having a poor outcome in the future, and the life expectancy will significantly decrease. Normally, if the case is a severe stroke and the person is bedridden, then normally they can even develop decubitus ulcer. Sometimes they may have aspiration pneumonia. Sometimes some persons may need to be fed with a feeding tube, or sometimes a surgical procedure is done on the stomach to feed them directly via the skin to the stomach. Alright? But with no further general discussion, I just want to incorporate my guest now into this podcast, and so she can share her story about her life with stroke. And her case is a stroke in the young, so it's additional workup for persons with the young, because we're not expecting someone young to get a stroke, especially if they don't have hypertension, diabetes, and they're not obese. So her story is a very interesting story. that is fitting for this factor. Once more, Miss Miller, welcome to the show. Alright?
Thank you.
Alright. So, young female, and at which age were you diagnosed with stroke?
I was 17.
17. So you're still in school?
I was just graduating from high school.
Just graduated from high school?
Like I graduated that July and I got it August.
Alright, so you're a healthy female that never been admitted before, don't need to go to any doctors, but not taking any medication, etc. before the stroke? Okay, alright. So what are some of the symptoms that you were having, and how sudden did these symptoms come on at the time?
At the time of the stroke, I was just sitting down and I just fell. The day I just fell and my mommy had to come. She took me up. I even urinated myself. I don't even remember how long that. At one point, I couldn't even speak.
You couldn't speak at one point. So which side of the body was weak?
Right side.
So both the right hand and the right leg were weak?
Yes.
As in you're unable to move them any at all, or still were able to move them?
Couldn't.
So the right hand and the right leg, lower leg, you could not move them any at all?
No. Actually, I was bedridden.
So how long did it take you to reach to the hospital?
About 10 minutes.
About 10 minutes? And when you reached to the hospital, what are some of the stuff that were done in the emergency room? Nothing was done? Alright, so when you were placed on the ward, they didn't take any blood test from you, they didn't do CT scan? The day after they did the CT scan. Alright? But they did blood work. So was there any abnormality with the blood works?
No. The only
Abnormality?
was pressure was high at the time, but like a couple of hours after they have done that.
Oh, so you actually had the pressure was high at the time when you got the stroke. Alright. So were you drinking like any energy drink or any other form of stimulant at the time?
The only thing I drank was a soda.
A soda. And were you aware of the heartbeat, like you feel like your heart was beating abnormal at the time? And no chest pain or anything like that? Alright. Now, in terms of being at the ward, you got the brain scan the following day?
Yes.
Alright, so what was the result of the CT brain at the time?
They said that it was a blood clot.
A blood clot? Oh,
Clot to the
in
brain.
the brain. Okay, alright. Alright, sorry to hear that, alright. And what are some of the treatment that you had gotten at the time? If you can remember, medication-wise.
Honestly, I don't remember.
Oh, you don't remember? Alright. And so were you like getting physiotherapy?
Yes.
That physio, so they were helping you with the limbs from then.
Yes.
And then what about the speech?
The speech just, it came back gradually.
Gradually. Before you were discharged?
No. After.
Oh, so while you were at the hospital, you were unable to speak.
Yes.
So, and how long were you admitted for?
1 week.
1 week? Alright. So did you have any additional complications in that time, like aspiration, pneumonia, or did you get the NG tube?
I got pneumonia when I came home. And then I came back here for admits.
Okay. So in terms of feeding, were you able to swallow?
Yes.
Were you able to swallow? So you did not need to get a tube in the NG tube. It's a tube to your nose, to your stomach. Okay, fortunately. So you said that the entire right side, you were unable to move the right side of the body, and you were bedridden. How long were you bedridden for?
I was bedridden for about 6 weeks.
Oh, 6 weeks.
Yes.
Okay.
Because what happened was when I started to come into the therapy, I just came back my mobility. Because when I put me in the wheelchair, take me here, and the first assessment they told me that I couldn't stand.
Okay.
And then the next one, I came, I was walking,
Oh, so you're getting some recovery.
and they told me that I was moving too fast.
Okay.
So I don't know if because I've been moving too fast, it slows me down back to where I can't do most of what I'm supposed to do.
Okay. Alright, so that's the thing with a stroke. Sometimes some persons strength will improve over a certain period of time. Some persons remain the same, while some persons would get worse. Alright, so fortunately in your case it was improving, so they probably was surprised that you were improving so fast. Alright, so I'm not really a therapist. I'm not certain what's the rationale for telling you to slow down. Alright, so I'm not really coming at the full story, so let's not get into that. Alright, but just say apart from the pressure was high initially, but you didn't know that your pressure was ever high before in the past.
My pressure was high.
It was just high on that occasion.
Yes.
Okay.
And even after that,
When
when I go to the doctors and the clinics, it's normal. Or even lower than I thought.
Okay. Now, in terms of so after the CT brain and the physiotherapy, you continue to follow up with the clinic at the doctors.
Yes.
Were you placed on are you on any medication now currently?
Yes, I'm on black girl.
Black girl.
Yes.
Okay.
That's a blood thinner.
Blood thinner. Okay. Alright. And but all the other blood works like the cholesterol was okay.
Everything came out.
Alright. So normally when a young person get a stroke, we normally do further testing, like we might test them for like collagen vascular disease such as lupus, etc. Or we might test the kidneys, we might test for other endocrine disorder. Were those tests done?
Yes, and everything came back normal.
Everything came back. So all your screening tests for secondary cause of the stroke was normal.
Yes.
Okay, so your case is still probably a mystery why you would have that one abnormal high blood pressure reading and you got a stroke. Alright. Alright, now in terms of the rehabilitation process, how long did it take you before you could get back to walk again? I said you were bedridden for 6 weeks. But were you able to just walk the 7th week, or you were in a wheelchair and then
I was in a wheelchair. I was in a wheelchair from about the September to the October.
Yes.
When the October rolled around and I came to Turkey, I just started to walk.
Just started to walk. Alright, so I'm happy that you actually recovered, able to walk again to an extent. Alright, but the hand seem like your right hand is still weak.
I'm not to my 100%, I'm like 70.
70, okay.
Yes.
But you're still able to get around without a walker. Which is
Yes.
good. Alright? Now, young female with a stroke, just graduated from high school, right? How did this change your life in terms of the plans that you wanted to become in the future and relationship-wise, family support? How did this incident affect your whole plans for the future?
It changed my whole plans dramatically because for one, I wanted to become a nurse.
Yes.
I can't do that anymore.
Okay. Sorry about that.
Relationship-wise, I never had a relationship because everybody needs to be going on.
Okay.
And until about 6 years ago, I have a son.
Okay.
That's why I know the story. In terms of family-wise, my family has had my back from day one. I'm a friend's house.
Okay, so you have good friends and family. Alright, so I'll give thanks for that, alright? But young female with a stroke, previously bedridden. So if you don't mind, tell us about like how you manage with the pregnancy and so forth. If you had a person with a stroke and think that they couldn't have a child.
Okay. Well, for the pregnancy, my doctor had recommended me to go to a specialized clinic. It helped me tremendously. And the day that I went in to have a baby, honestly, I don't know if it's a miracle or what. I didn't feel any
You
pain.
didn't feel any pain?
No.
Okay.
Everything just happened in a miracle.
Right. But since you were struggling to walk when you weren't pregnant, how did you manage to walk when you were pregnant and about to have baby?
Well, I managed.
You managed?
Yes.
You didn't use a walker?
No.
No, you're still able to manage.
Yes.
With the help of the Lord, you got the strength.
Yes.
Alright. Right. And in terms of, you said you wanted to become a nurse, but due to the whole stroke and you're unable to function with your right hand properly, you just change the career path, or you try to apply and they said that you're not fit?
Well, I tried to apply and they said that I'm not fit.
You're not fit to do it. Okay, so you actually denied entry into nursing school because of a disability now. Alright. So what are you doing now in terms of financial, in terms of a job or business or work?
I'm an entrepreneur.
Entrepreneur? What type of business do you operate now?
Well, I operate a beauty business. I make homemade soaps, hair oils, hair oils.
Okay. So what had inspired you to take on that project in terms of the entrepreneurial project and the manufacturing?
Alright, entrepreneurship, part of it. We are, and yeah, you don't need to do something that you're not passionate about. If you're not passionate about it,
Yeah.
it doesn't make any sense. So I was really passionate about making soups and mixing things. So that really grasped my objective in doing that.
Okay. Alright. And even though the end part, I would give you like thing to advertise the business, but we should probably just let the advertise it now. So just tell us about the business, what do you do, where you're located, your telephone number, your website, social media, etc.
Okay. Where my business is located is an online business. And my telephone number, which not to speak with.
No, your business, you don't have a business number.
No, I don't have a business number, correct.
So you have a website and your email.
Yes,
Tell them your email.
My email is richtrisha@gmail.com.
Alright, just spell it out for them, please.
R-I-C-
Okay, I can check on the screen as well, but spell it out and we'll put it on the screen.
Okay. RICHTRISHAMILLER.com. Or gmail.com.
Okay, alright. And what are some of the products that you say you sell again? You manufacture and sell? Type of soap?
I sell like face soaps.
Yes.
I sell hair growth oil, beard oil, lip gloss, all those.
Okay. So it's strictly online, you have to order it and you deliver. You don't have a physical location at the moment. Okay, alright. So definitely I think you should have at least a business phone number that you can give out to the public. Alright, that's
In
so
due time.
good. Alright, you will get there, alright? Now, any final word that you want to say to the public about the stroke and any advice to others with a stroke, how they manage to cope, etc. Support group, medication.
Well, I would say anybody with a stroke, don't make people make you feel like you're not valuable to society.
Yeah.
I don't make nobody put you down. Because a lot of people had put me down and to a point that I had low self-esteem, but I gained back my self-esteem. So don't make nobody put you down.
Okay. Alright, well said, alright. Miss Miller, thank you very much for coming and in office to share your story. You have to always give thanks to persons who come willingly to share their story with the public so the public can become aware of medical conditions and persons that are living with these conditions and how they cope, alright? So as you can see, you're still able to have your family, you're still able to do some business to sustain yourself. So actually, a severe illness like a stroke, which is basically you have a disability now, can still actually live a fulfilling life. And I wish you all the best for the future. And thanks very much for sharing your story with us again. We can tell you thank you. And alright, many thank you. Alright, good. So viewers, remember to share, subscribe, and leave a comment on this video. Until next time, stay tuned.
sure to subscribe for more informative contents on life, sickness, and death.